Have you ever submitted a claim thinking everything was lined up, only to get slammed with a denial that says, "Authorization not obtained"? Ouch, that's the one that makes you want to bang your head on the keyboard, right? If you're in billing, coding, or on the provider side, you know the pain, and authorization issues are probably the fastest way to turn a good day bad. Here's the thing. A lot of people get tripped up because they don't know when to use prior authorization versus retro authorization. Or hey, maybe you think you know, but then the payer drops a rule change and suddenly, denial city. So why does this matter? Because if you get it wrong, it doesn't just slow you down. It can delay patient care, delay payment, or in some cases, wipe out your reimbursement altogether. Even seasoned revenue cycle pros can stumble here if the process isn't crystal clear. So, let's break down the basics. Prior authorization, also called pre-cert or pre-approval, is when you get the insurance company's blessing before the service happens. Think MRIs, Connecticut scans, certain surgeries, or pricey meds. The provider decides it's needed, your staff checks the plan, sends the paperwork, and waits for the payer to say yes, no, or send more info. If it's approved, you're good. If not, you either appeal or change the plan. But if you skip prior auth when it's required, odds are that claim's getting denied no matter how necessary the service was. Now, retro authorization, this is your last resort. It's when you ask for approval after the service is already done. Sounds risky? That's because it is. But sometimes there's no choice. Like when a patient rolls into the ER unconscious and needs immediate surgery. There's no time to call the insurance company. So you provide care first and request retro auth after. Or maybe the patient's insurance plan changed and your system didn't update in time. You treated them, now you're hoping the payer will grant retro authorization. But here's the catch. Retro auth is never guaranteed. You need airtight documentation and a solid reason. And even then, it's up to the payer's rules. Sometimes they'll say yes, sometimes it's a hard no. Common mistakes? Number 1, assuming a service doesn't need prior auth just because it didn't last time. Plan rules change all the time. Number 2, submitting a claim before checking that the auth was actually approved, or worse, trying to sneak in a retro request without backup. That's a fast lane to denial. What helps? Use real-time tools like Availity or Navinet to check requirements. Build checklists by specialty or service and train your front desk to flag high-risk stuff before it's scheduled. And always make sure your documentation spells out why the service was necessary. That's your safety net for both prior and retro cases. Bottom line, prior auth comes first. Retro is the backup only when you really have no choice. Mastering the difference means fewer denials, faster payments, and way less stress on care and cash flow. Got your own prior or retro auth war story? Drop it in the comments. And hey, like and subscribe for more billing tips that actually make a difference.